Dereta, dereta, dereta. Stoppa, stoppa, stoppa. Muokere, muokere. Hop, 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 hop. Non muova. Ah, l'asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I wanted to vlog my first day in pediatrics. So for those of you who are interested in pediatrics or about to start your rotation, I know usually for me, whenever I'm about to start rotation, I get really nervous and I usually ask a prior student that was already in that rotation, especially if they're with my preceptor. So with the doctor I'll be rotating, I'll ask him, hey, how is the doctor? Do I need to know anything? How do I need to dress? Etc. So, or just what to expect in my pediatrics rotation. So I just finished my psych rotation. I've done ER so far, OB-GYN, surgery, psych, and this is my 5th rotation. So I still have, I have 3 more rotations to go through and then I'll finish my 2nd year of clinical year of PA school. So I'm currently in my 5th rotation, pediatrics rotation. So basically how my schedule was for the day today is that I woke up and I went to clinic. So I had called the office prior and I asked them what time I could arrive to the clinic since I don't know the doctor's schedule, and they told me just to be there by 9:30. So I got here a little bit earlier. Before that I got here at 9:15, and then I went to the back and just sat in the doctor's office and waited for him until he arrived. He arrived. He's a great doctor. He's amazing. I love him. He's great with his patients. If I had children or if my sisters were younger, I would definitely bring them to go see them because he's just such a fun person and such a fun doctor. He plays with his patients. He's very caring, and he's been seeing most of them for more than 20 years. So he has a lot of experience. And he's also seen previous generations, so I thought that was fantastic. So yeah, so I started at 9:30. Basically I shadowed him, and that's what he expects me to do, is to shadow him the first week. And then after that, since I'm rotating for 5 weeks, the next 4 weeks after the first week, he expects me to go and see the patients, work up the patients, diagnose the patients, treat the patients. And the thing about pediatrics that I think other PA students can tell you, or the PAs, is that dosing is really difficult because you have to dose the medication according to how much the patient weighs. So of course in kilograms, and then you have to calculate it. Some of the medical assistants there showed me some apps that they use. Since he does have a scribe that goes in with him every room, the scribes actually knew a lot more than I did when it came down to dosing and to know what medications to prescribe to certain patients or what medications he prefers over other medications. And so that's why it's really important that you're nice to your medical assistants, the MAs, and the staff that work in the office, because they can make you, or like they say, break you. And in this case, they've been very, very helpful for today, because I've been trying to keep up with the doctor because he sees so many patients. He's just going through room. So I'm trying to take notes to see what, like I said, medications he prefers over what medications he doesn't prefer. Of course, they're not antibiotics. For him, it's like not prescribing cephalosporins at all. He tries to stay as much away as he can from cephalosporins because, of course, they have the really bad side effects. Another medication he tries to stay away from is clindamycin, which has really bad side effects of pseudomembranous colitis, right? So like the stomach upset, something can be very deadly, especially in little kids. So that's why I try to follow the MAs and see what he prescribes and what he prefers. So yeah, that's how my first day was. So 9:30 until around 12 or 1, depending when you finish seeing the patient. And then from 1 to 3, I had a break. I ended up just staying at the clinic and I was just studying. I had to catch up on inputting my patients. So for PA school, your 2nd clinical year, I know it varies by school, but most of the PA students that I've talked to that are from other universities also had to input their patients. So basically every patient that you see, you have to go and you input it. And this helps you learn how to chart, so that way you learn how to place diagnosis, ICD codes, and do billing, etc. So I think it's really good practice and exercise, although sometimes it can get really hectic if you have a lot of patients. I know for my surgery rotation, I saw my doctor saw almost more than 50 or 40 patients a day, and it was just, sometimes I couldn't catch up in logging all the patients on my logs So I know sometimes it can be really hectic, and so that's why I try to catch up as much as I can and try to be catch up on every day, because if you do not chart like for one day or 2 days or 3 days or 4 days or a whole week, then you're gonna sit there charting for an entire day for that whole week. So that's why I try to make sure that I'm on top of it every day and nothing accumulates overall. So I took advantage of that time and I started charting patients. I came back at 3, and then we saw patients till around 6, and he told me I could go home even though he still had patients. So he let me go home, and this is where I am in my car now. I'm about to head home now. So yeah, that's how my first day in rotation was. Definitely it was a very, very busy day. You were seeing a lot of patients, and I'm really trying not to get sick because that's the stigma, and something all my classmates have said is to be careful. You want to make sure you don't get sick, because we've been seeing so many little kids with respiratory infections, especially since my rotation is in February, towards the end of February. You still kind of have patients going on with the flu, and then this year the flu has been really bad, especially like influenza A and B. So my doctor wears a mask whenever he goes into the rooms just to make sure he doesn't get sick and he doesn't get other people sick. And of course, washing your hands after every room to make sure you're not spreading anything. And when I was examining little kids, you have kids that will cough in your face. I had one that sneezed in my face, and I was like, oh great. But that's why they say that students get sick in the rotations, because their immune system just isn't accustomed to all the infections and bacteria and stuff like that. But yeah, that's how my first day in my pediatric rotation was. So I'll be vlogging hopefully throughout the rotation how my days are after my first week, to see how I am doing seeing my patients on my own, because he literally wants me to work them up, do the whole physical exam, come up with a diagnosis, at least 2 other differential diagnoses also, and what treatment plan I'm going to have for the patient, including the medications and the dosing also for the medication. So dosing is definitely something I have to work on. Thank God for apps, because I think that's what I'll be using, but we'll see. So I'll vlog in a few weeks to see how that goes. Alright guys, thanks for watching my video, and I'll talk to you guys soon. Bye.